Okay, good morning. It's 9:30. Today is Saturday, January 23rd, 2021. This is our scheduled yoga therapy class through Satyik Space, which we have been doing for a long time. Today's topic is yoga therapy as an emergent treatment. Yoga therapy, as I wanted to be sure what I wrote, was a treatment or therapy, emergent therapy or emergent treatment. Let me first start with you why I chose this topic as a discussion. We know from our experience that a daily practice of yoga is therapeutic, no question about it. It causes treatment of a disease, then it causes what is called maintenance of health. These maintenance of health prevent us from the progression of our chronic diseases or even a regression. Diseases like diabetes, hypertension, cardiovascular diseases. So, but what is the word came from as an emergent treatment? It came from few of my recent personal experiences. And let me go over with you what are my experiences. Then we'll go through the practices and you will see how effective these practices are. Like we do it all the time. We do it all the time. Wake up in the morning, you have a severe neck pain. What you do? Wake up in the morning, you have a severe pain in your hand. What to do? So the first question I was asked or faced is that a friend of mine who was diagnosed to have a COVID-19 and he recovered well, he got properly treatment, got antibodies and all the proper treatment. Then he was monitoring his oxygen saturation and breathing because there is a big syndrome being described now called a long hauler syndrome or called a post-COVID syndrome. People do have some evidence of pulmonary fibrosis. People do have some evidence of breathing difficulty for a long time. And one of his pulmonary physician asked him to do a voluntary regulated breathing. Say do some breathing, breathing control. We don't say breathing exercise because it's not a breathing exercise. It's a voluntary regulated breathing to improve oxygenation. So I was very impressed. I said, he got all the therapies for COVID-19 and as an emergent therapy as getting into the yoga practices. This is very recent. Another recent was another friend of mine who was hypertensive and his blood pressure went up. And this day and age, with all the emotions, with all the fear, all the anxiety, it's very common for your blood pressure to go high up. And he saw his doctor, and doctor added another medication. He was on one medication, now he's on two medication. And his doctor asked him, why don't you go ahead and do a relaxation response, do some yoga to see if it helps you to reduce your pharmaceutical support, reduce how much drug you are taking. So that also gives you some hope that even a primary care physicians are in the path of using yoga as a therapy. A few weeks back, I had another call from a mother and she also happens to be my friend, and she does, and in fact she practices yoga on her own. She used to come to our classes. Her daughter had about 4 back surgeries, back operation. Now she's living in a constant pain, and she has seen every known specialist in our modern medicine. And she was requesting that if she can get into some yoga therapy to control her pain and to get some relief from back. So I can give you on and on and on, and also we have enough testimonial, enough evidence. We have tons of people even in this town whose antihypertensive medication has come down, whose diabetic medication has come down. I know another person who shared with me, he was on 18 medications, and literally he's off all the medications now with the daily practice of yoga. He had a really severe, we call it metabolic syndrome. He had truncal obesity, diabetes, hypertension, coronary artery disease, dyslipidemia. Then he had a depression. He had a multiple, bone. And he was telling me, he was sharing with me, that what really helped him was a Kapalbhati pranayama, the breath of fire. He said, I was doing it, sitting in a chair, and slowly I could see my truncal obesity is coming down, my weight is coming down. And another one he shared with me, which was really very, very impressive, was that his son, who is still a teenager, just, I think 18 or 19, in that age range, he was started, according to him, gaining some weight, looks a little bit more not healthy looking, and that's what he was saying. It doesn't look like a healthy looking. And he asked him to sit down with him to do this Kapalbhati pranayama practice, and asana practice, meditation practice with him. And he shared with me that he's also started losing weight. He looks better. His performance is better. He looks more, has a more strength and stamina. So it's very impressive, very impressive. So let's see, what are the conditions we are using yoga therapy as an emergent treatment? Or let's go back historically. Historically, what happened in the United States, how it is getting incorporated in our Western medical system. As we know, in the United States, the principle, philosophy, practice of yoga was brought here in 1893, called Swami Vivekananda. He gave the lecture on Chicago Parliament of World Religion. That was exactly September 11, 1893. Following that, the person came who popularized, his name is Paramahansa Yogananda. Paramahansa Yogananda wrote a book called Autobiography of a Yogi, and he came around 1920, and he stayed here in this country for a long time, at least 40-50 years. And this book, Autobiography of a Yogi, became almost like a masterpiece, almost like a Bible for yoga practitioners and yoga therapists. In mid-60s, a lot of yoga practitioners from India started coming, like Swami Kripalu Nand, and he established a center called Kripalu Yoga Center, which is in Massachusetts, between Boston and Albany. Came Swami Rama. Swami Rama established Himalayan Institute in Poconos. Ram Das established in the West Coast, Mount Madonna Center. Swami Satchidanand established a center called Yogaville, which is in the south of Charlottesville, Virginia. Then Maharishi Mahesh Yogi. Maharishi Mahesh Yogi brought the phenomena here is called a transcendental meditation, TM. And it became extremely popular. Finally, he settled down in a place in Iowa, the small city called Fairfield, Iowa. Now it is called a Vedic city. And a lot of celebrities, people who became very attracted to transcendental meditation. That included a physician from Harvard. His name is Herbert Benson. It is around 1969, Herbert Benson went to study transcendental meditation, and as a physician, he noticed that during the transcendental meditation, there is some physiological changes in the body. Heart rate comes down, blood pressure comes down, respiratory rate comes down, your oxygen consumption goes down. I mean, he went on and on and on. And with all the information he had, he wrote a book called Relaxation Response. The book immediately became a New York Times bestseller. And when you read the book, what is interesting is that, look at the content of the book, you'll see whole content looks like it is like a meditation. Probably, I met him in person a lot of times at our conferences. Probably it is, my thought is that in 1969, he was hesitant to use the term meditation, and instead of meditation, he wrote the term called relaxation response. Now we know the outcome of yoga therapy is the relaxation response and activation of parasympathetic tone. Since then, there is people after people who started showing the effect of yoga, physiological effect. Swami Rama came. He was in Kansas, and these yoga practitioners, with the repeated activation of parasympathetic tone, they know how to control their autonomic nervous system. That means they can control autonomic nervous system, which ordinary people like us cannot do it. So he said that I can stop my heart. So he was hooked up to all the EKG monitor. There was a cardiologist who was been following him, and he did. He could stop his heart on his own, and during the cardiac tracing, it showed like he developed some atrial fibrillation. I think it's around the same time, 1969, 68, 69 at the time. But what was interesting is that in our hand, we have two arteries, one a radial artery and an ulnar artery, and he showed he could selectively shut down one of the arteries, and that is measured by the skin temperature. And with this information, things have started developing. We started to have some research going on. There was a researcher in University of Michigan and in California. They started doing research first on meditation. Then the medical centers started getting involved. Multiple papers being published, multiple research being published. In 1989, They have established a society called an association called International Association of Yoga Therapists. And they had a journal called International Journal of Yoga Therapy. They have another book, journal called Yoga Therapy Today. And today, most of the medical centers in this country, say Cleveland Clinic, MD Anderson Hospital, Sloan Kettering Hospital, any university hospital, Harvard Medical Center, they all have incorporated yoga as a therapy in their integrative medicine department. Integrative medicine is the integration of wisdom of the traditional system of healing with the science of our modern medicine. Integrative medicine became very popular, and in 2014 in America we have established a board called American Board of Integrative Medicine. Now the physicians who finish their initial training, maybe in internal medicine or primary care or different specialties, they can go through a 1,000 hour of training, 2 years of training, get certified in Department of Integrative Medicine. About 15-20 years back, maybe 3 or 4 medical schools out of today's about 140 medical schools had a Department of Integrative Medicine. Today over 100 medical schools have a Department of Integrative Medicine. 65 of them have the training program. 25 of them has their full fellowship program. So now the first medical condition where yoga therapy has incorporated as an emergent therapy is a chronic low back pain. When the chronic low back pain, because the pain comes from irritation of a nerve, we have a herniated disc, we have a spinal stenosis, but the pain comes from irritation of the nerve and contraction of the muscles. The muscles in the back tightens up, and all the pain fibers, remember one thing, all the pain fibers we have are in the muscle, tendons, and the ligaments. The bones do have some pain fiber in the bone marrow and periosteum, but the bone covering called cartilage doesn't have any pain fiber. People say, oh, my cartilage is broken down, I'm getting a bone to bone, that's what having pain. No, what happened when you have a bone to bone rubbing, that ligaments in the joint tightens up to cause what is called a splinting. That splinting causes the chronic pain. In chronic low back pain, you will feel in the back paraspinal muscle, when you feel it, feel like it is a 2 brick sitting here. So even if you go to a doctor with even acute pain, acute low back pain is a disaster. When you get acute low back pain, you cannot even talk. You cannot sneeze, you cannot cough, you cannot go up and down the steps, cannot even walk. You even bend forward like this. People say, looking at you, is a common term. They say, oh, you have a slip disc. It's a very serious issue. Even if you go to a doctor, even if they give you any narcotics, nothing works. So what works is your muscle relaxant. They'll give you a muscle relaxant that works. So the first, and also there is a big study done on the chronic low back pain, and multiple studies are done afterwards, but this was the first article being published in Annals of Internal Medicine. Her name was Karen Sherman, but the moment it was published, immediately, she became a celebrity. She was being interviewed by CNN, by ABC, NBC, CBS, name it, and papers being quoted, published everywhere. Now a lot of papers being published in established medical journals like say Journal of American College of Cardiology. They just had an article published, yoga therapy to help patient in cardiac rehabilitation following a acute myocardial infarction. That means after a heart attack, how yoga therapy is helping. The best medical journal almost in the world, called New England Journal of Medicine, they published an article from Herbert Benson and other. They call it a mind-body medicine, but it's all about yoga, asana, pranayama, and meditation and how it affects our medical condition. So chronic low back pain. Next condition, yoga therapy is very effective, people with cancer. It's not the cancer the yoga is treating, but associated symptoms with the cancer. Anxiety of cancer, sleeplessness, a lot of complications of chemotherapy. You know, today I'm going to do a little discussion because that practice I'll show you, you will all know, but let me just start giving you some examples so you'll understand what I'm talking about. Complications of chemotherapy, or as a primary prevention, secondary prevention, tertiary prevention. So this patient, also a friend of mine, his wife, she had a cancer of the breast, she had a usual treatment, surgery, local radiation, and chemotherapy. In a chemotherapy, she started having a severe reaction, also nausea, vomiting, a lot of other symptoms from the chemotherapy. What was interesting was she said that she started getting symptoms even before she get the chemotherapy. When she's even in the car, when she gets into the car, she has a port through which the chemotherapy is given, but she's symptomatic. So in yoga practice, we have the fifth limb is called the control of senses, pratyahara. So I told her, why didn't you practice little control of senses? She said, what? I said, before even you get into the car, you put an eye shield. Close your eyes. In the ear, put a earbud, like a book on the tape. Have a little bit of aromatherapy. Shut down all of your senses before you go for chemotherapy. She did that. She went to chemotherapy, and when they gave the needle, gave a chemotherapy, she did not have any symptoms. Controlling the senses. Anticipation of getting a chemotherapy, giving her the symptoms. Also, a practice of yoga these days causes down regulation of the gene. That the cancer is due to called an oncogene. I have genetic mutation or genetic changes of every cancer you can think about. I have oncogene for thyroid cancer, breast cancer, lung cancer, colon cancer, but this gene has to express, called genetic expression. Genetic expression is due to called epigenetics. Yoga therapy is an epigenetic practice. Yoga therapy prevents the genetic expression. So if you see a cancer patient, today we have a treatment through surgery, radiation, chemotherapy, but 5 years, 10 years down the line, they get another recurrence. Called recurrent, the disease comes back because the oncogene is still there and oncogene got expressed. Practice of yoga prevents this expression, prevents the recurrence, prevents the progression. So a lot of things you can say, like a metabolic syndrome, truncal obesity, diabetes, hypertension, atherosclerosis, blockage in the heart arteries, dyslipidemia, high cholesterol, high triglyceride, low HDL, all these things you can think about. It's also genetic, it came from a parent. Yes, practice of yoga prevents the genetic expression, called a primary prevention. Then when I have the disease, I get the usual and customary therapy, surgery, radiation, chemotherapy, whatever this is. Say I had a blockage in my heart arteries, I had an open heart surgery, I had a triple vessel coronary bypass 20 years back. If I have not incorporated yoga therapy, including my daily routine and my daily lifestyle, what will happen to me? This is going to come back. The blockage comes back. If you have angioplasty, after a few years, you get another angioplasty. That is called a secondary prevention. You incorporate yoga as a therapy after your primary, usual and customary therapy from modern medicine. Also, it's called a tertiary prevention, like say, I have a diabetes. If diabetes continues, diabetes will affect in my kidney. I get a kidney failure, renal failure, called diabetic nephropathy. Or I get eye changes, called diabetic retinopathy. Practice of yoga prevents that the complication, that is called your tertiary prevention. Metabolic syndrome, which starts with a truncal obesity, and we have talked about so many times, yoga therapy is the therapy. Diabetes, if you can do like Kapalbhati Pranayama, abdominal lock, Agnisar Kriya, you'll see your blood sugar will start to come down very soon. Chronic pain, joint pain is a wonderful practice. So let's start with a very simple, say, daily issue. Wake up in the morning, you have very simple, say you have a chronic low back pain. You have a chronic low back pain, you wake up in the morning, you develop very severe acute low back pain. You cannot imagine, unless you have a severe acute low back pain, how bad it is. You cannot talk, you cannot breathe, you cannot walk, you cannot turn around. So what you do, the therapy will be first for any kind of acute pain is called breath holding in inhalation along with relaxation response. What does it mean? If you are capable of sitting down in the ground like what we are, believe me, we also get acute back pain. If you don't have any back pain, you are the black sheep of the family. We all have a back pain. We sit down in a squatting pose. In a squatting pose is a relaxation of your whole body. Relaxation of your ankle, your knees, your hips, your back, your shoulder, you can name it. I'll show it to you. I show it to you all the time, but I will show it to you. But If you cannot, you sit down in a chair and you do first, breathe out first. This is called breath holding in inhalation in acute pain. You can always pop some pain medication. But you know, people have this pain medication doesn't work when you have acute low back pain. So sitting down in a chair with your spine straight, with your eyes closed, you breathe out first. You will take a deep breath in and hold the breath. When you're holding the breath, slowly and slowly, you drop your chin towards your chest. And keep holding your breath and keep counting. 1 and 2 and 3 and 4 and 5. See how long you can hold your breath without any effort. It has to be completely effortless, and effortless breathing is at the end you will be able to talk, you'll be able to sing. This is also called Murcha Pranayam, or Murcha means almost unconscious. When you are unconscious, we don't feel any pain. So let me show it to you first, and then you can do it. This is for acute pain. Breathe out first. No, first sit down with your spine straight, eyes closed. Breathe out first. Take a deep breath in. Hold your breath and incorporate a chin lock. Even if you cannot do this, a simple chin lock is good enough. Wake up in the morning. Wake up in the morning, you have a pain in your hand. All of us, these days we have called your arthritis pain, rheumatoid arthritis pain. Wake up in the morning, pain in your hand. Pain in your hand, therapy will be your call Adhi Mudra or Balo Mushti Mudra. Like a baby fist, the way I put a baby fist. Thumb will go inside and hand will close. When you get a acute pain in your hand, you will put the thumb inside and close, and you will do it with breathing. Like the way to do it, you can put your hand here, you breathe out first, take a deep breath in, breathe out, close your hand like a baby fist. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Then you can put your wrist and just keep rotating. This is for pain in your hand, in acute pain. Go both sides. This is almost, we call it like a money back guarantee. Pain will go away. And always use your fist like this, and you will feel a complete relief from pain in your hand. When the hand is relaxed, you will see your fingers are all separated. Fingers will go in and out before it's very tight. And it happens to all of us. Wake up in the morning, you get a pain in the hand. Wake up in the morning, you get a pain in your neck. You cannot turn your neck. You cannot do anything in your neck. It's a serious, serious condition. My grandma's tale was, put your pillow outside. Put your pillow outside in the sun. Let the pillow get warm. Sleep in a warm pillow, that could be gone. When we have a pain in our neck, we'll see generally it is on one side. And we'll see which posture we get the pain. Suppose I'm getting a pain on my right neck on turning my neck up to this far. This is first thing in the morning, I'm having pain. So I'm sitting in a chair, I'm sitting in a ground, I'm turning my head and then coming back a little short of pain. That means the posture or the position, I don't have any pain. And I stay here, I'm doing my breathing out first, then take a deep breath in and breathing out longer than breathing in. Take a deep breath in, breathe out longer than breathing in. Do 5 to 10 breaths, you will have a profound effect and the pain slowly and slowly will go away. Pain is still there. In the same posture now, you can do little bit of called bellows breathing, Bhastrika Pranayama. Like here, you do. Bellows is an active inhalation, active exhalation. Technique is you bring the organ or the body part which was causing the pain and come little short of pain. Same way, I have a pain in my left neck. If my pain is here, I come a little short of pain. Here I have a little discomfort, not pain, but I continue my bellows breathing. Bhastrika Pranayama. Active exhalation, active inhalation. In yoga practice, Bhastrika Pranayama is your pain relieving practice. What is the physiology behind it? Physiology behind it is called aerobic glycolysis. End product of metabolism is the glucose. Glucose combines with oxygen, produces carbon dioxide, water, and ATP. ATP means adenosine triphosphate. ATP is an energy, carbon dioxide comes out into the lung, water goes out to your kidney, you feel fresh, you feel better. If there is not enough oxygen, you develop called anaerobic glycolysis. Glucose with less oxygen produces lactic acid, pyruvic acid, pain-producing substances, then produces little bit of carbon dioxide, water, and ATP. And these pain-producing substances causes a serious pain. Also remember, pain comes from muscle contraction. So relaxation response is a therapy. Wake up in the morning, you have a pain in your shoulder. Pain in the shoulder is reality. Pain in the shoulder, it comes from called your rotator cuff tear. And rotator cuff tear happens very common to many of us. Pain in the shoulder takes place because you raise your arm. This is called abduction. You're raising your hand all the way high up, unprotected. We do it all the time, so we can do it very easily. So what is unprotected raising your arm? Very common occurrence is in your plane, in your cabin, you have a hand luggage, you want to take it up, put it over the overhead compartment. A true cause for the shoulder pain. So therapy is called adduction, adduction. Adduction means bringing the shoulder close to your body. This will be relief of your pain. Pain in the shoulder takes place. Pain in the shoulder takes place. Let me show the other side. It is called the external rotation. When you turn your shoulder like this outside, this will cause you pain. When you do the internal rotation, like hands coming inwards, this will relieve your shoulder pain. So adduction, and internal rotation. And both of them are achieved, we call it prayer pose to the back. So when you have a shoulder pain, acute, when you wake up in the morning have a shoulder pain, or when you have your chronic pain, take your hands to the back. I've shown it so many times. See, we're doing the same practices, what we do. But now we're talking about it disease specific as an emergent therapy. Hands in the back, slowly, as you have seen before, and let me show it to you again, how simply you can do it and how effective it is. So first of all, even if you can sit in a chair, or if you're sitting in a ground is okay, take your hands, and wherever it comes, if it comes together, it's great. Even if it is here, keep it here. Close your eyes and do the breathing. Breathing out first. Take a deep breath in, breathing out longer than breathing in. Slowly you can put your hands together and you can turn your hand like a prayer pose. Keep your spine straight. Keep your eyes closed. Breathe out first. Take a deep breath in and breathe out longer than breathing in. Do your breathing. The breathing is your pain reliever. And staying in this posture when you do the breathing, what you will notice, your hands will go high up slowly. And when you keep it longer and longer, all the muscle will relax, ligaments will relax, you will enter the different stages of the asanas, and to keep on going higher. And more longer and longer you keep it there, better and better will be your pain relieving. I stay here. I stay here between 5 to 10 breaths, sometimes longer, and my eyes closed. I'm doing my breathing, and many a time I will do little bellows breathing, like Bhastrika Pranayama with prayer pose to the back. Very extremely effective therapy. Extremely effective therapy for shoulder pain. And the way to do it is that, again, if I can show it to you, I will do a prayer pose to the back. See how fascinating it is to get pain. And then you will do in this posture the bellows breathing, Bhastrika Pranayama, like this. Wonderful practice. Keep doing it. If you keep doing it, you'll see the effect. As you see it, we do the wash our nose in the morning with the water, the jalneti, and we'll get some drainage from your neck. So for the acute pain, you always try to incorporate your asana practice with Bhastrika Pranayama and also breath holding and inhalation. What the breath holding and inhalation does, it is called CO2 narcosis. What is CO2 narcosis? When you hold the breath, your body builds up carbon dioxide. When the carbon dioxide gets built up, it produces called carbonic acid, and it acts like a narcotic. So the same thing will happen. I'll put my hand in the back as a prayer pose to the back. See how beautiful it is. And I will incorporate called Murcha Pranayam with prayer pose to the back. I breathe out first. Take a deep breath in. Hold my breath and bring the chin towards my chest. In a neck pain, we do a practice called Brahma Mudra, like putting your neck to the back, to the front and the side, looking in the back and turning. Very difficult to do. Very difficult to do in a neck pain. So in the neck pain, as I said, best thing is turning your neck and doing the Bhastrika Pranayama. Many a time also we do call it bumblebee breathing, Bhramri Pranayama. The same, suppose I have a pain on my looking at my left side. I'll come to the point where there's no pain. I breathe out first. Take a deep breath in, and breathing out will be longer with the sound of a bumblebee. Try this. Try these practices and you'll feel a wonderful relief. And this is the emergent therapy. Emergent therapy. For chronic low back pain, therapy is a supported back bend. Supported back bend means back bend on your mat. Unsupported back bend causes more back pain. Unsupported forward bend also causes more pain. In fact, a lot of school for a chronic low back pain ask you not to do a forward bend. But when you have acute pain, you will see how effective is supported forward bend. And I'll show it to you and you will be amazed. So let me show you if you can do this, which in a practice, as I said, in stages, impossible become possible. So if you're able to sit down in a squatting pose, so if you sit down in a squatting pose, and you will see children sit down in a squatting pose all the time. Sit in a squatting pose, keep your spine straight. Put your hands together, extend your wrist, separate your fingers, put your one elbow inside, other elbow inside, and slowly bring your hand close to you. Keep your spine straight, eyes closed. You do the breathing out longer than breathing in. In acute pain, you incorporate the bumblebee breathing in your exhalation when you breathe out. So how you will do it? In this posture, take a look at how beautiful it is. You'll breathe out first. Take a deep breath in. It's a guaranteed therapy. Do it. If it doesn't work, call me. As we always say, if you can take the heat, get out of the kitchen. This is going to work. One more time. Breathe out first. Spine straight. Eyes closed. Squatting pose. Breathe out first. Take a deep breath in and breathe out to the sound of a bumblebee. From here, you'll try to get up without a support. So if you can get up without a support slowly and able to stand up and stand up. Then this is called your Dandasana. Keeping your whole body straight. Your ear, your shoulder, your hip, and your ankle in the same line. The moment you keep your body straight, most of your aches and pains goes away, relaxation response sets in, and your parasympathetic activation takes place. Now let me show it to you what you will do when you have a severe acute back pain. Severe acute back pain, you cannot even turn, you cannot, this is very good for acute back pain, but you won't be able to do it. You are almost, it is so severe pain, you are almost like this. This is called, people will say you have a slip disc. You cannot even get straightened up. So, if you can go, say, find a place where you can support your head. Okay, let me show you in stages. I'm a little bit distant, you may be able to see, but just to give you an idea what it is, you stand next to a supported, suppose a supported head. Okay, so what you will do, you will slowly bend your head down and support your head. It is a supported forward bend, and then put your hands on both sides. Keep your eyes closed and doing breathing out longer than breathing in. It's a wonderful practice, and slowly you will see when you are able to do it as support, thing happens. So now from there, what you can do, you can come down little lower, like here is my another little lower. So I do the same thing. I'll come down here. I have a serious back pain, and when I put my back down, I also support my hand. This is called a supported forward bend. Here I am coming down, put my head here, and just a hand loose. My hands are all loose. My whole body gets relaxed and loose. This is as effective as any muscle relaxant medication. Close your eyes. Breathe out longer than breathing in. So we're showing you in stages. So when you really want to show it to you that how to do it, suppose you can do it with your another lower stool. Like here it is. Now you are here, you are supporting yourself. See, my knees are straight, my legs are straight, supporting myself. Slowly and slowly, I drop my head down. I support my head. And if the hand goes too far down, I put my hands here, close my eyes,
I'm breathing out longer than breathing in. This is the way you break the spasm of the muscle to get rid of the pain. Unless you can break the tightness of the muscle, the pain is not going to go away. This is called emergent therapy, yoga therapy. We are incorporating you with all the acute problems we have. Slowly when you get up, again get up with the support. Hold your hand, get up with the support. In the same way, you will be able to see when you can go all the way further down, you'll be able to do hand touching your feet. And the moment you do it, that you put your feet together and have your hand. Hand is supporting. And also remember, your spine is straight. How do you know your spine is straight? You're looking straight at you. Look straight at you. And then slowly keep coming down. Put your hands down here. You're coming here. Slowly you're touching your hand on the ground. Hand on the side. Slowly you can put your hands to the back and bring your head touching your knee. My eyes are closed and I'm breathing out longer than breathing in. Now let me show you one for your knee, hips and the lower part. And this is the pain, I hear it from everybody all the time, from all my friends, including myself. Also have a serious, I have a little sole in my right knee, a lot of pain in my knee, but I'm very comfortable, I'm functional. So, when you have a knee pain or a hip pain, you find the posture where it causes pain. Also your breathing. When your breathing is complete, it is called a 3-stage breathing. And you breathe out. It's a wonderful practice. Suppose you get a pain putting your feet high up here. Now you have a pain in your knee, pain in your hips. So you go a little short of it. Now you don't have any, you have a little bit of a discomfort, but you don't have much pain in your hips and knees. Even if you cannot do it, you can put your feet on a small stool like this. Take your feet high up, put it high up like this. Support. Short of pain. Now you keep your spine straight, Close your eyes, and even in the hand, if you do your baby fist or yogic fist, it relaxes. Put your hands in both sides. Close your eyes, breathing out longer than breathing in. Now you're very comfortable in the support. You can do a Bhastrika Pranayam, raising your hand high up and pulling it down, and you will see you will get a relief from your shoulder, neck, hips, knees, and all the major joints and joint pain. Look at this, how beautiful the practice is. My eyes are closed, my hands will be high up. Breathe out for the active breathing and pull it down with a yogic fist, baby fist. Let's do it a few times and see how effective it is. Continue as long as you can without any effect in your breath. Without effect in breath means you can talk, you can sing. Same way as on the opposite side, try to put it high up here or go high up here. Can't do it? You can go all the way high up here. No. Wherever you can. Cannot do it? Put a support here. Support here. Put your feet in a support. Put in a support. You are sitting in a chair. Continue breathing out longer than breathing in, at least 10 times, if not longer. And also incorporate some bellows breathing, Bhastrika Pranayama. Beautiful here. You can do a little faster Bhastrika Pranayama. See? You'll be amazed what these practices do to your body and mind. At this time of our life, we start living with a chronic pain. We start living with acute pain. Wake up in the morning, you get a pain. Pain in the neck, pain in the back, pain in the knee, pain in the hand, pain hips, ankle, my God, everywhere in the body. We have done every test, everything, cannot find anything. It is a part of life for our age group. I have a neurologist friend, he had a very fascinating statement. He told me one day, he said, when you have the pain, when you wake up in the morning with the pain, you are lucky. You are still alive. Dead people don't feel pain. I said, okay, thank you. I won't complain pain to you anymore. So supported position for a joint which is short of pain, then incorporate Bhastrika Pranayama.
Also, other pranayama which are also very effective as a pain but takes a little longer time are alternate nostril breathing and a bumblebee breathing. So many a time I ask people to do whatever posture you have a pain, and in that posture you continue your very simple alternate nostril breathing. And let me show you how we do it. In a lower extremity problem, sitting in a chair, we incorporate your eagle pose. In an eagle pose, you put your one leg on the top, stay here, do your breathing out longer than breathing in, slowly and slowly. You can take your feet, go all around, wrap it around, and this is called your Garurasana eagle pose. Keep your spine straight with the eagle pose. Left hand, use a Dhanu mudra or a Ganu mudra. Touch your index finger and thumb. Put it gently over your knees. Right hand, close the right nostril. Close your eyes. Breathe out through your left nostril. Take a deep breath in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. So how to incorporate a asana with a pain relieving pranayama. Slowly put your index finger and middle finger in your third eye, between the eyebrows. Use your left hand to hold your right ear low to balance and continue your alternate nostril breathing. Cannot have a better practice than this. Go to the opposite leg and do a bumblebee breathing, Bhramari Pranayam, with your eagle pose. Now your left leg goes high up, stays high up for a while. You can take your feet, bring it back, slowly turn around, wrap it around. You will sit down in a eagle pose. Here I am sitting, I'm closing my eyes, breathing out longer than breathing in. Many a time I'm having dinner, the head is my table, here I'm eating, underneath my leg, I put my leg in an eagle pose, eating my dinner. My mind is diverted because my mind is in my eating and food, and slowly all my pain goes away.
If you're sitting in I can read a newspaper, sitting like this. And for your whole, incorporating it in your modern day medical therapy, do the bumblebee breathing. Put your index finger in the forehead, so rise with the 3 fingers, close your ear with your thumb, close your mouth. You shut down your vision, your hearing, your smell, and the taste. Breathe out first, breathe in through the nose and breathe out with the sound of a bumblebee. After bumblebee, always doing pumping and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Put your hands over your eyes. Let the eyes take all the heat from your hand. Massage your forehead. Massage your eyes, massage your face. Remember, all the muscles in the face are attached to your skin. When the muscles are relaxed, all the frowning goes away, all the line goes away. Massage the back of your ear, front of your earlobe. This is your auricular branch of the vagus nerve, called vagal activation. Massage in the front of the neck. This is your carotid sinus. Your massaging helps your relaxing your cardiovascular system, nervous system. Massage your back. So how you're incorporating our asana, physical poses, with the pranayama practice as an integral part of our therapy. So we have all the chronic diseases. We have a heart disease. We have all the heart disease, everything. With this relaxation, it is going to have a parasympathetic activation, reduction of the pharmaceutical support. Even sitting down here, you can be sitting in a chair, putting your feet here, your hands in a baby fist, even put it, support, put it on your, I'm putting on my little bit of a supporting. I can do a Kapalbhati Pranayama. So Kapalbhati pranayama is a metabolic pranayama. It's for your metabolic disorders. Very good for diabetes, cholesterol, all metabolic disorders. Sitting down here, you can do all. You can do an abdominal lock. You can do all the practices for diabetes, which you do. In an acute situation, whenever you have a hard time moving, turning, like for sitting down, a profound relaxation will be your thunderbolt, Vajrasana, and then you are called Mandukasana. So let me show it to you. Everybody, I get so many not complaints, I get so many requests. I cannot do it. How should I do it? Let me show it to you how easy it is to do it. So you can see I'm sitting on my ankle, and this will be very easy for you to do. It is not going to be difficult. So if you are doing it, so from that here, what you can do, slowly and slowly, you go back and keep your back straight. Or if not, you can go a little bit in the forward and put your feet slowly down and sit down here comfortably. And slowly go to the back. Keep your spine straight. Now this is the time I hear people are complaining that I cannot do it. So when you cannot do it, let me show you with your feet how you'll be able to do it. Take a little bit of a roll. Maybe you can take a roll. You can take a roll of your mat. You can take a roll of your mat. You'll be able to do it. Or your problem which is an ankle, you take a little bit of a little pillow, put it under your ankle. Under your ankle, and then you'll be able to sit down. Did you see how comfortable it is? And this is the most relaxing. Anytime you have any kind of issue, this is good for diabetes, good for cardiovascular disorders, good for your truncal obesity. It ignites your Agni. It is called a Agni Deepan, igniting your digestive fire. This is called your thunderbolt pose. People say, I cannot go down. No problem. It's okay. They have a little bit of a small pillow. Put it here and able to sit down. Personally, I prefer your folded blanket. In a folded blanket, what happens? that when you develop that habit, which you call a neuroplasticity, you can slowly and slowly take out those layers. And you will be doing without it. Slowly you'll be able to do it without it. You'll be able to do without this. From here, you will do a Mundukasana, rock pose. These are the asanas and pranayamas which are a part of your emergent therapy, which will be incorporating in your integrative medicine to get a profound effect and result. Hand in a baby fist, put it at the level of your belly button. Breathe out first. Take a little breath in. Slowly breathe out. Suck your stomach in a little bit and slowly keep going down as far as your body will go, and put your head on the ground. When your head comes in the ground, stay here, breathing out longer than breathing in. In a laying down postures, you will also remember, people always wants to do your cobra pose, locust, your bow pose for your back pain, but in an acute back pain, you won't be able to do it. So what asanas can you do it? And then we'll incorporate asanas laying down, how to sleep. Remember, when you get a good night sleep, dream less sleep. Dream is in called REM sleep, rapid eye movement. You need a dreamless sleep. You get dreamless sleep, you overcome almost every condition. Sorry, I got a couple of messages here. Let me go a little bit further down so you'll be able to see me better. Okay. Suppose you got a very serious back issue, what you will do and how you'll sleep. Now, you will be on your, say first, you'll be on your face down. In your face down, you'll see how you are going to. So your face is down, and put your one hand on the top. Come back a little bit, high up. One hand on the top, and your feet together, semi-fine. Put your head down. Breathe out longer than breathing in. You will start feeling the relaxation of the muscles of the back and relaxation of your whole body. This relaxation response activates your parasympathetic tone. Normally from here, you'll be able to push yourself high up slowly and slowly to get into cobra pose. But you won't be able to do it in severe acute back pain
or a serious situation. What you do in that condition is that now you turn your face. I'm turning it to my left side. From here, you take your right hip. Make a hip along right angle to your body. And when it's a right angle to your body, and then you do your knee also right angle to your thigh. So you're looking at the hip is at right angle, knee at a right angle. Now you put your face down on your hand, face turn towards left side, close your eyes, breathe out longer than breathing in. Stay here, do at least 10 breaths. Count of 2 in, count of 4 out, count of 3 in, count of 6 out, count of 4 in, count of 8 out. You have practiced with me, practice. It's a wonderful practice. From here, now you go back, straighten up your leg. Now to the opposite side. Now my face is turned to my right side. My right hip comes to the right angle. My right knee is at the right angle. Again, I stay here for about 10 breaths. Then when you feel a little bit better and better, then you can do slowly a supported back bend. Like supported cobra pose, supported your locust, your bow pose, but I will go very slowly and gently. Practice this first. This is your complete relaxation and complete preparing your body from your all the acute conditions you have. Now, you need to incorporate a good dreamless sleep practice as a part of your yoga therapy protocol, as emergent therapy. And let me show it to you how you incorporate this breathing, the sleeping technique to your a daily practice as a part of your emergent therapy. Now you want to lay down on your back. So you're laying down in your back.
when you're laying in your back, be sure your chin is little further down. Don't let this thing happen. This is very sympathetic. So try to do this as much as possible. If not possible, again you can take a little small pillow, put it under your head. Then you sleep like a baby. What do you mean by sleep like a baby? Have you ever seen how the baby sleeps? Baby sleeps with a supine closed angle pose. Supto Baddha Konasana. You put your both the feet together, put it in your ground, and let both the knee drop down. This is the way the baby sleeps. Baby even sleeps with a baby fist like this. Baby fist like this with a called your sleeping closed angle pose. Now initially you won't be able to support your knees. In that situation, what you can do, you can take one small pillow on both sides and support your both the knees, support your head. This is a guaranteed dreamless sleep beginning. We'll show it to you all the steps of yogic sleep. Next, you will incorporate a breathing to help you sleep. First, breathing will be breathing out longer than breathing in, between 5 to 10 breaths, but deep, long breath. We've been doing it for a long time. We breathe out first, then we'll breathe in with a count of 5 in, 1 and 2 and a 3 and a 4 and a 5. Then you breathe out, count of 10, count. I'll do about 5 of those breathing, and you'll see how you slowly and slowly get into this relaxation. Breathe out first. Breathe in with a count of 5 in. Breathe out with a count of 10 out. Let's do the same for 4 more times. 5 in and 10 out. You will immediately fall asleep. It will feel that your sleep is coming. Always remember, sleep has your lag phase. Like when you get into the bed, you don't fall asleep right away. If you fall asleep right away, that means you are sleep deprived. But you did not sleep good enough last night. If you don't sleep even after 30 minutes, you are having insomnia. So between 10 minutes and 30 minutes is a sleeping lag time. Next, you incorporate breath holding. And the way to do the breath holding is you breathe in with a count of 4 in, breathe hold for a count of 16. 4 times. Then breathe out with a count of 8. 1:4:2. Then when you can do it effortlessly, you keep on increasing your time. Like you will do count of 5 in, count of 20 hold, count of 10 out, count of 6 in, 24 hold, 12 out. If you can stay there, do it about 4 or 5 times and you'll see how it affects your sleep. So you are in sleeping like a baby. This is called your Supta Baddha Konasana. Supta means sleeping. Baddha Konasana means closed angle pose. Hands in a baby fist on this side, both sides. But I want to show you one time, and my hands will be like this too. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. Breathe out first. Breathe in with a count of 5 in. Hold your breath for 20. Breathe out with a count of 10. If you can continue here, that's very good. If you can continue further, better. Always remember, when you do the real breathing through your nostril, all the air goes to your throat. And in the larynx, when you have a little bit of a laryngeal spasm, tightness, you do get a little cough, and which is entirely normal for pranayama practice. So don't get very concerned with this. I can do a little farther, so let me show you one more time. Breathe in with a count of 6 in. Hold your breath for count of 24. Breathe out at the count of 12. So do this about 5 to 10 times. Then bring your breathing like a belly breathing like a baby. If you say baby, when a baby breathes, you'll see when the baby is breathing in, the abdominal wall will rise. Breathe out, abdominal wall will go in. Breathe in. Breathe out. Practice this 10 to 20 times. Remember, when you fall asleep, when you get into called non-REM sleep, non-rapid eye movement sleep, which has 4 stages, stage 1, stage 2, stage 3, stage 4. Stage 3 and 4 is called a deep sleep. In that deep sleep, all the repair in the body takes place. In yogic way of sleeping is when you're feeling a little bit of sleepy on this posture, that you turn on your right side and sleep. Like yogis generally don't have any pillow. They take the hand, they put the head on the hand, put the feet like a fetal position, and they sleep. Initially, you may have a little bit of a discomfort when you wake up. You may feel like we call it thoracic outlet syndrome. You may have a little numbness in one of the hand. So you can again use a small pillow and sleep in a pillow. Use your both the hands, maybe on the side. And then close your eyes. What is happening here? Sleeping on the right side, it opens your left nostril. Your left nostril is cooling. Left nostril is parasympathetic. Left nostril is called moon energy. Chandra Nari, Chandra Bhedi Pranayama. Initially, our body core temperature is up, and during deep sleep, our body's core temperature comes down. Deep sleep, we get relaxation of all the muscles of the body. Yoga practice is a balance. When my body core temperature is high, I'm breathing through my left nostril, which is cooling, and my body temperature is getting balanced. It is amazing yoga practice that everything you do in a balance. Let me tell you a very interesting thing. In yogic tradition, when your outside temperature is high, you're feeling warm, your body's inside temperature goes down as a balance. If you want to drink a liquid at the time, yoga says you drink a warm drink to balance the cooling temperature inside. We do completely opposite. Summertime, we drink a cold drink. Yoga says summertime, you drink a little warm drink. In the winter time, our inside temperature is high. Yoga says you drink a little cold drink. So next, when you are feeling completely sleepy, you turn on your left side and sleep rest of the night on your left side. So that, just to show it, let me show it to you from the other side so you will see what I meant is that here, then you'll be sleeping on your left side. You're sleeping on your left side, again, feet in a fetal position, hands on both sides. If you can put a hand like this, it is very good. If you cannot, if it is here, it is nice. Now you are on your left side. You close your eyes and you are sleeping. What is happening here, lying on the left side, my right nostril is open. I can even check it. Right nostril is open. Right nostril is called your hitting. Right nostril is your sympathetic. Right nostril is called your sun energy. Right nostril is called your Suranari, sun energy, Surya Vedi Pranayama. Now in a deep sleep, my inner core temperature is down and right nostril breathing is balancing it. And this is the way I sleep rest of the night. Wake up completely refreshed, and we are in a meditative state throughout the whole day, so we don't need much sleep. We need very little bit of very deep stage 3 and stage 4 sleep. It is not how long you sleep, it's how good you sleep, how deep you sleep. When you wake up, keep your one leg straight on the top, put your little hand here, and slowly get up and sit down. In a sitting down, what you can do here is a wonderful meditative practice. In a meditative practice, you are using your both hands, touch your index finger and thumb. This is called your Gyana Mudra or a Dhyana Mudra. Put it over your knees. Close your eyes. And you enter into a silence. During silence, what you do, you practice alternate nostril breathing without closing the nostril. This is called meditative alternate nostril breathing. This is
in fact, a cure-all for all the chronic diseases. This is called meditation as medication. Let me guide it to you, but you do it in silence and you'll see the effect of it in your body and mind. I'm just showing you the technique, but you do a little longer at home. Bring your awareness to your left nostril. Breathe out through your left nostril. And breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing in through my left nostril. I'm breathing out through my right nostril. Then I do it in silence. Slowly put your both the hands in front of you. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. This is your lotus mudra, Padma mudra. It connects your body, mind and spirit. Heart is the site of your soul. Slowly bring the lotus close to your heart. Heart connects through your mind. Body and mind is connected, that is yoga. Yoga is the union of your body, mind and spirit. Yoga as a therapy is an adaptation of the yoga philosophy, adaptation of the practice of 8 limbs of yoga based on person's clinical condition. It is a part of integrative medicine, part of as an emergent therapy, part of a therapy which is being accepted by most of the healthcare provider today all over the world and also primarily in the United States. It creates a relaxation response, creates a parasympathetic activation to control our flight and fright response with a calm and digest. Bring your hands slowly close in front of your heart chakra. Eyes are closed, spine is straight, and finish with another palming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take the hands like a cup. Put it over your eyes like a cup. Let the eyes take all the heat from your hand. Your breath becomes very relaxed and deep. Slowly massage your forehead, massage your eyes, massage your face. Go behind your ear, in front of your ear, in the tragus, in the ear lobes. These are branches of the vagus nerve. Activate relaxation response. Come to the front of the neck, massage your carotid sinuses for relaxation. Go to the back, and it's a wonderful practice. Thank you for staying with us with this wonderful session. called yoga therapy is an emergent treatment or emergent therapy. And we'll be back again on Saturday with another session. If you have any request, you can ask it to me and we'll try to fulfill your request. Okay? See you next Saturday. Bye-bye.